The broadcast is now starting. All attendees are in listen-only mode.
Welcome, everyone, to another WIC WORKS webinar from the California WIC Association. Today's topic is Cannabis, California Laws and Public Health Implications. We're glad you're with us. We hear from local WIC agencies in California that participating families report using marijuana or cannabis, often without realizing or accounting for the potential risks for pregnant and breastfeeding moms or their children. The passage of Prop 64 last November decriminalized the cultivation, possession, and use of cannabis for non-medical purposes, but the public health impacts could be wide-reaching, and we want you to be informed. It's a complex issue, and California is a large and diverse state. Considerable time and much effort to develop the legal and practical aspects of implementing this new law. Although we realize no one has all the answers worked out yet, California WIC Association seeks to offer reliable, evidence-based information about this emerging topic via this webinar. We're not here to promote the use of cannabis, of course, just as we wouldn't be promoting the use of alcohol or opioids or another substance if we were hosting a webinar around the impacts of their use. Our mission compels us to provide educational opportunities for our members and the wider public health community. So we're glad you joined us today, and we're also grateful to have staff from 2 state agencies to provide us with reliable information. After a few web reminders about logistics and continuing education, I'll introduce our experts. Just a reminder that everyone is in listen-only mode, and so the way to ask a question is to type it into the question box on the control panel on the right of your screen. And I will prioritize those questions and read them to the panelists at the end of the webinar, and we'll get as many answers as possible. We hope that you have brought a lot of questions today. And also a reminder that we are recording this webinar, and you'll be able to find a link in a follow-up email that you'll receive tomorrow. It's also going to be posted on our website with a lot of resources and materials and the presenter's slides. For those of you who are interested in earning continuing education, I just want to review the requirements for that. We offer CPEUs and CERPs for dietitians and lactation professionals. You have to have registered in advance. You need to attend the entire webinar live. And if you are attending on a computer other than the one that you registered, such as with a group, you need to send me some documentation that you attended. You'll need to complete the evaluation survey that will be linked in your follow-up email tomorrow. And then if you want a certificate, there's a way that you'll be able to purchase that. So if you have any questions about that, just let us know after the webinar. Now I'm going to introduce our first speaker as I pass the presentation baton. It's Dean Graffilo. Dean has directed the California Department of Consumer Affairs since February of this year. And with the department's executive team, he leads the 40 regulatory entities and other divisions within DCA. Prior to his appointment, Dean was Chief of Staff for Assemblymember Rob Bonta and Associate Director of Government Relations at the California Medical Association. He's also worked for Assembly members Furatani and Tarico and several labor unions in Washington and Hawaii. Dean Graffilo also has a Master of Public Administration degree from the University of Washington. Thank you so much for joining us today, Dean. And it looks like we've got your slides, so take it away.
Thank you so much, Margaret. Such a pleasure to be here today. I'm going to quickly go through some background on this exciting new area of regulation for California and obviously a few different agencies. Appreciate the brief introduction. I'd be remiss if I didn't mention that when I was Chief of Staff for Assemblymember Bonta, I left the office there on March 20th of this year. now 5.5 months here at TCA. That Assemblymember Bonta was one of the key authors of the Medical Cannabis Regulation and Safety Act. I didn't staff that bill, but long way for me to say that I've been able to see this issue evolve both in the legislature and now obviously in the implementation stage here with the Department of Consumer Affairs and other departments that I will briefly talk about, and that another panelist is going to talk more in depth specific to the California Department of Public Health. So it's very interesting for me personally and professionally to be engaged on this issue. As folks may very well know, depending on whose numbers you believe, this is a multi-billion-dollar industry. And what we do here in California, at the risk of sounding grandiose, will have an impact nationally, if not globally. And ideally, we want to start out right with strong consumer protections and health safety provisions so that naturally, so that we can ensure the utmost safety for everyone involved. As this industry evolves, so will regulations, just given how dynamic this issue is. And just moving along in the agenda, or with the agenda, try to keep it simple, going to try to keep it straightforward, talk about the cannabis law, this background, both past and future and current. It's going to be, at times, we're going to get into the weeds a little bit. I'm going to do my best to try to keep it high level so that if there are, in fact, specific questions at the end, we can get to those as well. So just a quick background. As noted there, in 1996, Proposition 215, otherwise known as the Compassionate Use Act, was passed by California voters by a margin of about 11%. It was like 55.5% to 44.4%. And ultimately, you know, that act allowed for the use of medical cannabis. Zoom forward to 2003, I guess appropriately entitled SB 420, the medical marijuana program. I believe that was Senator Vasconcellos. But that was the first attempt to establish statewide guidelines to regulate, enforce, and that one of the key provisions was that it allowed for a voluntary ID card specific to medicinal use. Zoom forward to 8 years after that, as I mentioned, MCRSA, the Medical Marijuana Regulation and Safety Act, authored by not only Assemblymember Bonta, but there were about four other authors on that bill, which set the stage for what happened in 2016 via the initiative proposition process with the AUMA, otherwise known as the Adult Use Medical Act, Prop 64. That saw similar success of Prop 215 in 1996. That passed with actually closer to 15% vote margin of the voters, 57% to basically 43% of the voters supported Prop 64. And then the governor's office, others, the departments, Department of Public Health, CDFA, obviously Department of Consumer Affairs, heavily involved in one of the budget trailer bills of this past fiscal year, 2017, SB 94, often referred to as trailer bill language for the Bureau of Cannabis Control. But the goal of that trailer bill was to merge both what happened in the legislature in 2015 under MCRSA, sometimes referred to as MCRSA, and AUMA, again, which is the Prop 64, which the voters passed in 16. And so again, SB 94 of this past budget cycle was passed which again merged MCRSA and AUMA. And that is where we are at currently in terms of the most recent budget bill that was signed into law by Governor Brown. In reference to be clear, BCC on these slides is in reference to the Bureau of Cannabis Control. And real quick overview of this new bureau that is one of 39 entities under the Department of Consumer Affairs. Again, via the Medical MCRSA Act, it was established in 2015. Side note, the name of the bureau has gone through a couple of name changes, but to be clear, it is currently known as the Bureau of Cannabis Control. Again, it's the lead agency in the development of the regulatory structure for cannabis. The bureau chief, who unfortunately isn't here today and has vast expertise on this issue, is Lori Ajax. She was appointed in February of 16. And I encourage you, after this or whenever going forward, the Bureau, in conjunction with DCA and the other departments that is leading the charge specific to regulating cannabis, we do our best to always open door and communicate, because we know, again, this is a new area of regulation for the state, and naturally we want to try to be as responsive and provide the most up-to-date information as possible. Again, Lori Ajax is the preeminent expert on this issue. And it's also important to know that via MCRSA, the Medical Cannabis Bill, which was then echoed in Prop 64, which was then mirrored in the most recent trailer bill language, that there is an emphasis on a dual licensing model, meaning that both local jurisdictions have to allow for cannabis opportunities, and the state has to also as well. So it's not as if, if some jurisdiction has deemed it unlawful, cannabis activity being unlawful, the state cannot, I repeat, cannot supersede what the local jurisdiction has done. The only way the state is also going to provide a statewide license is if the local jurisdiction from wherever the applicant is applying from has allowed that as well. We can obviously talk a little bit more about that if there are specific questions. So this slide spells out, again, the three departments, agencies that are responsible for the different licensing categories. As it is explained here, the Bureau of Cannabis Control is responsible for licensing the distributors, the micro businesses, the dispensary/retail outlets and testing labs. The California Department of Food and Ag are going to be licensing the cultivators. They're going to also be responsible for the track and trace system. That briefly is just a way for us to literally, or specifically in CDFA, to literally monitor cannabis from its infant stage to its actual consumption stage. Naturally, if something goes awry in that process, we want to be able to identify exactly where there has been some kind of concern, and the track and trace model is going to allow us to do so. And then over at the California Department of Public Health, they're going to be responsible for licensing manufacturers. Fancy way of saying basically manufacturing cannabis, like raw flower cannabis, to edibles or tinctures, or like I just said, the different forms of consuming cannabis that is already in the market in other areas. And I would be remiss if I didn't also mention that the Department of Public Health is going to be responsible for spearheading the public outreach campaign to educate the public about cannabis and how to keep it away from children. The goal is to start launching it prior to January 2nd of 2018, when the other departments start opening its doors to start issuing licenses. Naturally, we'd want to get ahead of that. And again, California Department of Public Health, and we'll be launching that. I'm sure Michelle can speak to that specifically. Head into what the Bureau of Cannabis Control has been up to. Starting in April 16, we had informational sessions throughout the state, literally trying to get a better understanding of folks' concerns, thoughts, otherwise on the issue of cannabis. We've held these 9 informational sessions since 2016. It was a way for us to be a public face for the Bureau. I had the pleasure of attending some of these. It was specific to regulations, which I'll get into in a further slide. But I think there's no way better to really get a sense of, again, people's thoughts, concerns, otherwise on issue, other than literally going out to the public, having these town halls, informational sessions, so that folks can get familiar with who is in fact at the Bureau, who is in fact going to be making decisions specific to cannabis. And again, or not again, but I should mention that ultimately the goal is to bring an industry that has been in the shadows for many generations into a fully regulated market. And I think it behooves California state government to be approachable, be the positive face for this industry. So that was the primary goal of these informational sessions that we started in April of 16. Related to those informational sessions, we started pre-regulatory workshops in September of 16. 8 of those were held, and as noted in the slide, the goal there was to get feedback on the initial draft of regulations. Those drafts were based on what happened with the Medical Cannabis Regulation Act that I mentioned before. As you folks may know, so much of what happens after a bill is signed into law is that issue often has to go through the regulatory process. Part of that process is having these pre-regulatory workshops where it's so valuable in getting the public involved and to make sure that the draft regulations are going to be better informed, when in fact we are seeking out input from the public. And it also, we were able to get a glimpse of the direction that the Bureau was going in. I should say the public was going to be able to get a glimpse of direction that the Bureau was going to go in specific to the eventual regs. CDPH was involved in the manufacturing aspect of the regulations. We provided draft regulation concepts and asked for feedback. This allowed everyone, stakeholders, industry, and the public, to really be part of the process. Again, that's in the vein of hoping those that were once in an unregulated market to get fully engaged. Continuing on in the draft regs process, the Bureau did issue draft medical regulations based off the feedback that received, and Those workshops happened in April and May of this year. The public was permitted and solicited input on the regulations in 4 major areas of California, as noted here: San Jose, Sacramento, Los Angeles, Eureka. I was able to attend the Los Angeles public comment forum, and the room that we utilized was literally standing room only. I completely recognize LA as a large metropolitan area, but my point in mentioning it is just the overwhelming interest and engagement of the public was really, really great to see, because we clearly recognize that we're only going to be successful if, in fact, the public is engaged and involved. And it was, again, great to see that involvement. And I should also mention, in the other 3 areas, there was similar participation and attendance from the public. Continuing on with some of the activities of the Bureau, there's a web portal noted here, www.cannabis.ca.gov. It's going to be a one-stop shop for everyone: consumers, licensees, stakeholders. And the goal there is to get the latest information on all things related to cannabis. As you can imagine, it's still its initial stages, but it will, in fact, be the place to get all the latest information and news. Naturally, the only way that the Bureau and the state's going to be effective is if there is a strategic outreach plan. We've done a lot already. We have a lot more to do, but we've done a lot of outreach to all parties involved. And again, throughout this process, we believe that the Bureau is going to be able to be seen as a transparent organization, open-minded to receive the views of all stakeholders, all industry, and all public partners. In no way do we have a monopoly on good ideas, and so we're always going to be wanting to get feedback, receive keen insight from anyone and everyone, quite frankly. So what's next for the Bureau? With the 2017 trailer bill, SB 94, that was passed, and the merging of, again, the Medical Cannabis Act and Adult Use Act, Prop 64, the regulation process now has meant that we are withdrawing the medical regulations. Those are basically null and void because, again, we have a new law, the trailer bill, via SB 94. But it's very important to understand that so much of the great work that was done via the medical regulation process, it informed and has informed and will continue to inform what we're going to do with the MAUCRSA regulations, Medical Adult Use Regulation and Safety Act, also known as MCRSA. Again, what we did previously is absolutely informing what we're going to do via these regulations that are pending to come out in early November, similar to the regulatory process of every regulatory process. We're going to be seeking comments from all stakeholders because it'll be an emergency reg process because of the timeline. There'll be a 5-day comment period for folks to obviously, again, provide some input. Part of that also involves an economic impact report. Continuing on with the regs process, this is where it's going to can get a little weedy. I'll refrain from going too much into the weeds, but as part of the regulation process, these items are issues we're still going to need to fine-tune. So what's the definition of an owner of a cannabis entity, the impact potentially or not of past convictions for applicants, continued operations while an application is pending, priority licensing and security requirements. So much of that still needs to be fleshed out. So much of it, there's a lot of interest. And again, via the reg process, the emergency reg process, is when we're going to learn so much more about that. Other details to come are specific to distributors. All medical cannabis goods must first pass through a distributor. The distributors are going to work with testing labs to make sure there's quality assurance. The distributors have the option to purchase the medical cannabis or provide services without taking ownership of the medical cannabis. However, it's important to know that distributors may not package or label manufactured medical cannabis goods. As I understand it, that's going to be to the responsibility of Department of Public Health. Transporters are another entity that we're going to have to get more details locked down via the regulatory process. The transportation of medical cannabis goods may not be performed by air, watercraft, drones, or rail, human-powered vehicles, or unmanned vehicles. All transport personnel must be 21 years of age or older, and to ensure the medical cannabis is, in good order. It may be stored at the transporter's premises for no longer than 72 hours. Again, this is a way to help ensure consumer protections and public safety. No question, dispensaries are going to be a key cog in this process. The retail space is obviously going to be the face for cannabis, or the interface for cannabis for many folks. Preliminarily, looks like medical cannabis, it's looking like the delivery of medical cannabis may happen between the hours of 6 a.m. and 9 p.m. Granted, there may be changes in that via the regulatory process that's going to be happening between now and November. Again, the dispensary delivery employees must be 21 years of age. All vehicles cannot contain more than $3,000 of medical cannabis. Untested medical cannabis goods in a dispensary inventory and may be sold for a limited time after licensure if the product is properly labeled. Again, anything that goes out in the public has to have proper labeling. Details to come specific to testing. There are provisional testing lab issues that need to be determined. Sampling, naturally, in order to ensure that the cannabis product meets important health and safety standards. Got to determine the proper amount of sampling, and the testing labs again are going to be critical in that process as well. So what's next for the Bureau and the department? The goal is January 2 of 18, which is just around the corner, that we'll be able to start issuing licenses. Granted, temporary licenses will be issued come January 2nd. That's going to be based on whether or not an entity currently is permitted to operate. We're going to try to start accepting applications as early as early November ideally maybe even mid-November. A lot of these we'll be having workshops throughout California so that folks have a good understanding of the licensing and application process. As alluded to earlier, it's going to be a collaborative effort that is going to involve CDFA, CDPH, GOBIS to a certain extent, the various taxing agencies that are all going to be involved in order to ensure that the application for licenses goes smoothly, and ultimately that an entity who has in fact applied is going to be able to get a license. And naturally, we're going to provide the opportunity to ask questions at these workshops, so folks are better informed as we head to a January 2nd opening. Other things that the Bureau is involved in via both the Medical Cannabis Act and Prop 64, there's an advisory committee to be determined exactly how large that advisory committee is going to be, but the goal is to have literally experts on the issue ready for the Bureau to interact with, to provide key and insight, direction, and insight for how to move forward. It's going to be a CEQA process involved. As I mentioned earlier, there's going to be continued outreach so that every corner California is informed about what the Bureau is doing and how folks can get involved and engaged. We're going to be updating the website, so easy access for folks to get key information, and we've already commenced hiring staff for the Bureau. Naturally, we want folks to be engaged, involved, and encouraging as many folks to apply to the various licensing, enforcement, other positions that the Bureau is hiring for. So real quick primer on current law. As of November 9, 2016, the ability to possess, transport, obtain, or give away to other adults 21 or older, but could be no more than 1 ounce cannabis or 8 grams of concentrated cannabis. Folks currently can cultivate up to six plants per residence and possess cannabis produced by these plants. All plants in a harvest in excess of 1 ounce must be kept in a locked space, not in public view at one's residence. Local governments may still forbid cultivation outdoors, but must allow it inside a private residence or accessory structure that is fully enclosed and secure. Additionally, medical cannabis patients can keep their existing rights under Prop 215 to possess and cultivate as much as they need for personal medical use, as long as they have a doctor's recommendation, regardless of Prop 64 limits for adult users. Retail sales for adult use will not begin until licensed stores are in operation after January 2 of 2018. In the meantime, Prop 215 patients with a doctor's recommendation can continue to purchase at medical collectives and dispensaries. Patients who have a state medical cannabis ID card will be exempt from state sales tax. Here's some do nots. Cannot consume cannabis in any public place, It's a $100 infraction. On-site consumption at licensed premises will be permitted at a later date. Folks cannot smoke or vaporize cannabis in any non-smoking area or within 1,000 feet of a school, daycare, or a youth center while children are present, except privately at a residence. That's a $250 fine. And people cannot consume cannabis or possess an open container of cannabis while driving or riding as a passenger in any motor vehicle, boat, or airplane, and that too is a $250 fine. People may not possess or use cannabis on the grounds of a school, daycare, youth center, while children are present. $100 fine. People cannot manufacture concentrated cannabis with a volatile solvent, except for state licensed manufacturers. Minors under 21 may not possess, use, transport, or cultivate cannabis. Pardon me. They're subject to a $100 fine for those 18 and older. Minors under 18 are subject to drug counseling and community service. Possession of 1 or more than 1 ounce remains a misdemeanor, punishable by $500 and or 6 months in jail, as at present. Other offenses, including cultivation of over 6 plants, transport, other items, they're downgraded from felonies to misdemeanors, except in certain aggravating circumstances. And I know I quickly went through those portions, but I wanted to be mindful of time and make room available for Q&A. There you have my email, and questions, if you wanted to follow up via call, can be had at our Consumer Information Center, 1-800-952-5210. That's the end of my PowerPoint.
Thank you so much, Dean. It was great to hear of your outreach efforts and sort of what's still to come. We've gotten one question so far, and I hope more are coming, but I think probably a lot of people are waiting, as I am, to see if our next presenter might be able to answer those questions. So I will pass the baton to Michelle Woods. Thanks for joining us, Michelle. I'm going to just say a little bit about you so people know who you are. Michelle is a health education consultant with the California Department of Public Health, Cannabis Information and Education campaign. She told me yesterday it's 6 weeks old. So we're really thrilled that she was able to jump in right away and help us with this webinar. Michelle has over 7 years of experience with CDPH, coordinating public outreach and training programs for the Safe and Active Communities branch, the California Colon Cancer Program, and the Nutrition Education and Obesity Prevention Program. So welcome, Michelle. I hope we can see your slides. It looks like we can, so take it away.
Great. Thank you very much, Margaret. I would like to thank the California WIC Association for the opportunity to participate in today's webinar. And I will be sharing information about the California Department of Public Health Cannabis Public Health Information campaign. So in addition to establishing a licensing and regulatory structure for the cultivation, manufacture, distribution, and sale of cannabis, the legislation that legalized cannabis in California also includes public education goals to inform residents about the health impacts of using cannabis. And those goals are to inform the public about the scientific basis for restricting access of cannabis to people 21 and older, the penalties for providing access to cannabis to use under 21, the potential harm of using cannabis while pregnant or breastfeeding, and the potential harm of overusing cannabis. To achieve these goals, the Department of Public Health is developing a health information and education campaign to provide cannabis users with the facts they need to make safe choices and to share science-based research about how using cannabis affects our bodies, our minds, and health. The funding for this program is only for 1 year at this time. Oops, sorry about that. We are currently in phase 1 of our Let's Talk Cannabis campaign. On September 1st, we launched a website where you can find fact sheets and frequently asked questions about what's legal for adult and medicinal cannabis users, how cannabis affects the health of pregnant and breastfeeding women and their babies, and how cannabis affects the memory, attention span, and mental health of teenagers and young adults in their early 20s. This fact sheet also includes information about the risks of driving under the influence of cannabis and poisoning from eating edible cannabis products. We also have a parent and mentors fact sheet, which describes steps parents, guardians, and trusted adults can take to discourage youth from using cannabis, and a safe use fact sheet, which includes information about creating safe environments for children. All of these fact sheets can be downloaded and printed, and the what's legal and safe use fact sheets are also available in Spanish. I would like to reiterate that in this phase of the campaign, we are primarily focused on meeting the statutory requirements to provide information about the risk of cannabis, and the materials that we have posted on our website contain the most important facts that Californians need to know. So this is basically just the basics at this time. So I'm going to take you on a quick tour of our new website, and bear with me for a moment here. Great. So this is our Let's Talk Cannabis website, and as you can see, we have pages which address the important information that each of our target audiences need to know: pregnant and breastfeeding, youth, parents and mentors, information about safe use, and we also have helpful resources. And then over here in our side navigation bar, we have some quick links to each of our focus group pages, and we also have a place where you can download all the fact sheets, and all the frequently asked questions are all on one page. So that's a place where you can go to if you quickly want to download something. And then on our En Español webpage, we have the resources that are currently available in Spanish. So I will just take a few minutes to go to one of our web pages. I'll go to the pregnant and breastfeeding web page, just so you can see what they look like. So we have some basic information about the risks for pregnant and breastfeeding women. We have links to our pregnant and breastfeeding fact sheet. And on this page, we also have a fact sheet that is for healthcare providers, OBGYN and pediatricians and other healthcare providers, that provides more detailed information. And we have some frequently asked questions that pertain specifically to pregnant and breastfeeding women. And let's see. I will open up the pregnant and breastfeeding fact sheet just so that you can see it. We're going to be talking about this briefly a little bit more, but I'll just give you a feel for how they look. So one thing that I would like to emphasize is that all of our fact sheets are science-based, and we do have the citations of the research that was used in the development of the fact sheet. And one more thing I'll tell you before we leave the web page is that on the helpful resources page, we have additional information that to support the safe use of cannabis. So we have a link to the California Cannabis portal, We have links to California Poison Control System, a link to the California Office of Traffic Safety, which includes information about driving under the influence, animal poison control, just in case pets accidentally consume edible cannabis products. And also we have links to some of the different data and reports that were used in developing our fact sheets and our website. So, oops, excuse me, I'm sorry about that. Okay, so one of our fact sheets is what's legal, and Dean has already gone over a lot of the information. These are just highlights of information that's on our that is on our fact sheet, and I'll just sort of point out some things that perhaps Dean has not covered. Employers do have the right to prohibit employees from using cannabis. You cannot take cannabis across state lines, and cannabis is legal in California, but it is still illegal under federal law. So you cannot use cannabis in federal parks, even if the park is in California, or on other federal lands like Bureau of Land Management. So the key message for pregnant and breastfeeding women, and this is just a highlight of some of the information that's included on our pregnant and breastfeeding women fact sheet. The key message is that there is no amount of cannabis that's safe to consume while you are pregnant and breastfeeding. The American College of Obstetricians and Gynecologists and the American Academy of Pediatrics recommends that women who are pregnant or thinking about becoming pregnant soon should discontinue use of cannabis, and women who are already using cannabis for medicinal purposes should discontinue using cannabis in favor of an alternative treatment, which research shows is safer during pregnancy. And as I mentioned, also on this page, you will find a more detailed fact sheet that's specifically for healthcare providers. And so here are some of the key messages that are on the fact sheet that, that we would like to see communicated to pregnant and breastfeeding women. We have information about how THC, the active ingredient in cannabis, reaches babies to the bloodstream, to the placenta, and breast milk, and in secondhand smoke. And also some key facts on how cannabis can harm babies: low birth weight, health problems during the first year of life. It harms the growth and development of a baby's brain. And also mothers who use cannabis while they nurse, their babies sometimes have trouble nursing because of sedation, reduced muscle, and poor sucking ability. So the last resource that I will highlight for today's webinar is our Safe Use Fact Sheet. For parents and caregivers that use cannabis, this fact sheet includes important information about how to keep children safe. Recommendations are that cannabis should be kept in the child-resistant packaging that it came in when it was purchased at the retail outlet. Cannabis should be stored in a locked area that children cannot see or reach. And secondhand cannabis smoke contains THC and other chemicals, so it's really not safe to smoke cannabis around children. Another very important fact is that children are at higher risk for poisoning from cannabis, especially with edibles. So another important fact is that, you know, as I mentioned, the recommendation is that parents and caregivers not use cannabis around children, but if they do, it is important that the parent or caregiver should make sure that an adult who can look after the child is nearby. Now that we've launched our Let's Talk Cannabis website, we are working on phase 2 of our campaign, and this phase will include developing targeted messages for vulnerable populations, collaborating with local health agencies, and developing prevention strategies about the harmful effects of cannabis. And the prevention strategies will target youth, young adults, pregnant and breastfeeding women, and also infants and children. I encourage all of you to visit our website, Let's Talk Cannabis, and here's the URL. And you can also email us at letstalkcannabis@cdph.ca.gov. Once again, thank you for inviting me to participate in today's webinar.
Thanks so much, Michelle. It was great to get that information and to have a tour of your brand new website. And that URL on this slide, of course, looks very long, but for the attendees who are panicking about getting it just right, don't worry. We will have it posted on our website after the webinar, and these slides, of course, will be available, and we'll have it linked where you can find it. We also have a WIC Can Help campaign that's for information and referral on a variety of topics. And I believe it's the month of June, is substance use prevention. So we'll make sure that all these new resources are posted there. So it's question and answer time, and I'll just remind people to type it into the question box and I'll screen it. But we have several to start with, so this is great. Thanks for submitting your questions. First one is, how can we, let's see. I want to start at the beginning for those early birds. So are there copies of the draft medical guidelines available? That might be a question for you, Dean.
Yeah, so if I'm understanding the question, it's probably the draft medical regulations. And
okay.
If you go to the cannabis website that I mentioned earlier, there should be either direct links to the Bureau of Cannabis Control website, and you can even Google the Bureau of Cannabis Control, and then they will have direct links to the regs. And the website address for the Bureau is www.bmcr.ca.gov. Again, www.bmcr.ca.gov.
Yeah, and we'll include that in our webinar resources as well. Thank you. The related question by the same person was, are there any guidelines related to pregnancy or perinatal use? And I think that's been answered by you, Michelle, so thank you. Another question. Yeah, this is where it comes down to the rubber meeting the road. How can we protect our WIC clients from the secondhand effects of the fumes when a dispensary or cannabis cultivators move in next to our WIC office? I don't know what kind of public education you might be able to recommend to them, Michelle. Or are there any regulations related to that under development, Dean?
Yeah, it's my understanding that there might be some siting regulations, but I'll let Dean speak to that.
So that specifically is yet to be determined. Thinking about this just off the top of my head, I suspect locally there may be ordinances that either may currently exist or could be passed. At the state level, I have yet to hear any discussion about addressing, WIC-specific establishments.
Yes, I would also add that as we continue to develop our campaign, we'll also be providing information about safe use in different contexts as well.
Okay, thanks. Another question, can people smoke outside apartment complexes when children are present?
So, as I understand it, landlords will still be able to determine whether or not they're going to allow cannabis use on their premises. So, irrespective of, children present or not, it will be up to the landlord to decide, as I just said, whether or not cannabis is permitted on their property. It's a private property right.
I think that's the idea, and I suppose if it's public, that would be a city ordinance or county.
Yeah, I guess it would depend on the public entity, but to your point, that makes sense.
Yeah, just to add to that, currently it is not permissible to smoke cannabis in public places. So
Right.
It is permissible on private property, but not public places. But Dean is also correct that landlords do have the discretion to and the use of cannabis on their private property.
Okay, great. Here's a question. Will it be legal for dispensaries or cannabis outlets to sell cannabis to pregnant and breastfeeding women?
That specific question has yet to be entertained. I suspect a dispensary, it's, as you can imagine, hard to determine whether or not an individual is pregnant. So on its face, a dispensary isn't going to be able to ascertain that. But in discussions thus far, haven't had a discussion to that level of specificity.
Yeah, just to add to what Dean said, it's my understanding that the only requirement for being able to use cannabis as an adult user is that you are over 21. So I don't believe at this time there is any specific provisions that limits the sale of cannabis to pregnant or breastfeeding women who are of legal age.
Okay, thanks. Just we have time for a few more questions, and this one is interesting because a lot of our WIC staff are mandated reporters. So one of them is asking, should we continue to report to DCFS or local police if we suspect or see the caregiver or parent using cannabis?
Hi, this is
go ahead, Michelle.
Dean.
I was going to say, I have to plead ignorance because I'm not familiar enough with the mandates of mandatory reporters in this space.
Yes, I would also say the same thing. I don't know if there are any changes in the mandatory reporting requirements.
Yeah,
let me jump in and also say that come January 2nd, in no way, shape, or form are we going to be at a place where every issue is going to be able to be addressed similar to this. And so whether it's what the industry looks like January 2nd, how regulations look like, and how we are going to enforce looks like in January 2nd may be quite different come June of 18, come December of 18. The point being is, as this industry evolves, I suspect so will legislation and enforcement.
Yeah, good point. And we are at the early stages, I know. Here's one related to when we were talking about whether a dispensary could sell to a pregnant or breastfeeding woman, and even if there's no restriction in that regard, could they be required to have warnings about the effects of marijuana use during pregnancy and breastfeeding, similar to a beer bottle? Is that in the works? Do you know, Dean?
Yeah, the specifics of like the
Warning
labeling
labels?
requirements.
Mm-hmm.
Yeah, that is still going to be determined via the reg process, and I would suspect that that's good public policy, and if in fact good public policy prevails, those type of information is going to also be included. But again, whether or not it is in fact going to be is to be determined.
Yeah. All right, lots of good questions here. I guess I'm going to end with this last one, and we may not know the answer, but it does bring up an interesting issue related to breastfeeding, and that's if a mother tests positive for THC in the hospital post-delivery, will she be permitted to breastfeed? I don't know if anybody's heard of how that fits in with the baby-friendly hospital initiative, but that's something that will be faced, I'm sure, or maybe already is, and I'm not sure how it's handled, probably differently in different hospitals.
Yeah, I would concur, Margaret. At this time I don't know the answer to that question, but it's perhaps something we can look into for the future.
Great. Thank you both. Our time is up, but there were just a few more questions, and I just want the attendees to know that we're not, we will have a record of all your questions, and I will forward those to the presenters. You will also have their contact information on the slides, and all the materials will be on our website by tomorrow, including a recording of this webinar. Thank you, Michelle and Dean, once again for helping us, helping shed light on this emerging issue, and for participating today. We're really grateful.
Thank you so much.
Thank you, Margaret.
All right. Take care, everybody.
Bye-bye.